Okay. Okay, we're gonna go ahead and start the presentation. We're gonna do a presentation today from Quint Tax Services. We're gonna present Cover California program and what it is. We're gonna see different points. The overview of what Cover California is. How can you apply? Also, if you qualify for any free help um, from the program itself, and to see if you qualify for a free healthcare coverage, and then see how can you apply and get free help from people near your area or from us. So we're gonna go ahead and go right into it. These are our presenters. My name is Carlos Daniel Quintana. I'm the CFO of Quint Tax Services, and Carlos M. Quintana. He's in the other line. He's the CEO of Quint Tax Services. So we want to welcome you, and we're going to explain to you what Cover California is. So basically, the vision of Cover California is to provide health plans and health insurance for everyone to have health coverage. So millions of Californians will be able to choose affordable quality health insurance coverage offered through Cover California that took effect on January 2014. So right now we're in the period where we have all to sign up. They extended the period where we have to sign up for to get coverage within the year of 2013. If not, if you don't sign up, then when you do your taxes next year, then you might get some penalties in your taxes when you do them if you don't have that coverage. You will also be able to learn if you qualify for Medical. Cover California is a new, easy to use marketplace where you and your family may get financial assistance to make coverage more affordable, and where you will be able to compare and choose health coverage that best fits your needs and budget. So, by law, the coverage cannot be dropped or denied, even if you have pre existing medical conditions or you get sick. So you may have thought that you couldn't afford health insurance, but Cover California will provide the tools for you to shop for health insurance that meets your healthcare needs and your financial realities. So the federal law called the Patient Protection and Affordable Care Act that provides a number of ways for individuals and employers to help make coverage more affordable for individuals. Uh, Cover California is also a part of California, the state of California, and was created to help you and your family get health coverage to protect yourself and your loved ones. Having insurance is more important to stay healthy and pay for health care if you get sick or you get injured. So we're gonna go ahead and start some other parts of the presentation. We already went over what is Cover California and what is Obamacare. It's basically the same uh, uh, program. Is just for Cover California is just for residents here in the state of California. The medical program. What is the medical program? The medical is California's healthcare program for individuals who make less than $15,000 a year. So if when you go to the Cover California page, there is gonna be a page that says preview plans. We're gonna go over that right now. And if you put your annual income in there, and then the people that live in your home, you're gonna go ahead and see if you qualify for medical or if you qualify for any discounts for your health coverage. So how can you know that you qualify for this program? If you see here, the number of people per household is one. If you make annual income of $15,860 or less, then you qualify for medical, and this is free insurance basically. If you are one individual at your home and you make $15,000 or to in between 15,860 and $45,000 960, then you qualify for different discounts through Cover California, and so on. If you have two individuals at your home and your annual income is $21,000 or less, then you qualify for free help. If you have two individuals making 21,400 to 62,440, then you qualify for discounts. And progressively, until, for example, you have five, you make less than 38,000, free medical, or discounts between 38 and 110. So, how can you apply? We're in the privileged position to be touching lives and making history, helping people to get medical insurance. And you can do that by calling us at 562-291-2316 and make your appointment. Or you can also visit the website Cover California. So I'm going to go ahead and exit from the presentation, from the PowerPoint presentation, just for a second. And because I want to show you how this actually looks like when you go ahead and go to the website. So basically, you're going to go to Cover California, and you're going to click here on Apply Now. This is in case you want to try and see the plans for yourself first. Um, when you click there, you're going to see it's going to prompt you to create an account, whether you're an individual or a family or an employer. If you're an employer, then it's a different kind of portal, and we cannot assist you with that. An insurance agent would be able to assist you with that, and the numbers are going to be provided for you once you go ahead and opt in for that option. But if you're an individual family, we're going to be able to help you out. So first, if you want to, before you apply, if you want to preview the plans, you can click on this option on preview plans, and it's going to ask you to put in your zip code. So I'm going to go ahead and show you step by step right now on how to see the plans real quick. So let's put in a zip code right now, and let's say that your income is $45,000, and you have maybe three people on your home. So let's say that you're 35, your significant other is 36, and let's say you have a child, and your child is 12 years old. It's gonna ask you if anyone is pregnant in your home, your wife is pregnant, your girlfriend, or if anyone is disabled. Then you're gonna go ahead and see your results. When you do that, it's gonna tell you, yeah, you qualify for medical. So you're gonna go ahead if and see if you qualify for medical, and then see the fact sheet, and how can you um, qualify for this plan. And also, if you want to just get health insurance, you can go ahead and preview the plans here in this option. So when you click there, it's going to prompt you to see if you can put the medical use, how many visits to the doctor you do a year. So if you're low, you only go to the doctor 1 or 2 times a year, 5 to 6 month, and or if you go monthly or 20 plus a year, you're gonna put the number of individuals that have that use for a doctor. So let's say that you all three have low visits to the doctor because you're a healthy family. You only go once or twice per year to get your annual checkups and stuff like that. And prescription use, since you're a healthy family, you only have one prescription or less. So we're gonna go ahead and do that. If you already have a doctor, you're gonna go ahead and click here, and then just find your doctor to see if he's gonna be in the network for the plan that you're gonna select. Right here, it's gonna load up some of the plans that you may qualify for, and the discounts that you qualify for. So it'll give you three options. There's more option if you click the arrow here. So, but right now we're gonna just go over the three that we have here in the front. So LA Care would be a bronze. You have to look at these letters up here in the front. Bronze is a plan where it's cheaper. If you can notice that, $118, and then this Molina Healthcare, it's gone $136, and then the silver plan is $233. This price is the premium for the whole family. It's not individual; it's for the whole family, and it'll tell you how much here is helping you cover California. So, if Cover California wasn't helping you, then the premium would be, for example, here $490, But since they're helping you, according to the income that you put in there, it's gonna give you the premium in a month. So you have to be really careful on the plan that you select according to these letters right here. If we go down here, it's gonna tell you the overall quality of these plans. So whether it's a 3 star or 2 star, and you're gonna start noticing the prices and how it changes, according to the plan. So these are the product type. You're gonna go ahead and see here what kind of product it is. It's an HMO in this case. This means you can check here what an HMO is, but basically it's a plan where you can only visit the doctors within the HMO network. So the doctors that are here on HealthNet, you can only visit the ones that, you know, they're in the network. Or if you already have a doctor, you have to check to see if the doctor is in that HMO network. um, you're gonna see here what are the deductibles, and so your deductible in these bronze plans are $5,000. So it's a little more expensive, although they're cheaper in a monthly premium. They're probably gonna be more expensive in the long run. So after you see these details for deductibles, then you can see what the co-payments are. By visiting here in this doctor visit page. So on the bronze plan, $60 for copay, $60 for copay on this one, and then $40 copay. There are some other plans. If you keep browsing, there are some other plans that the copay will be $15, but the premium a month will be a little bit more expensive. So you really have to see what your financial situation is and see if you could afford that plan, and then you can go ahead and check all the details. Once you're ready to, once you have selected a plan, let's say you like this one very much, after you checked all the details, you can go ahead and put apply. Once you click apply on this, is going in that option is going to ask you to create an account. So you're going to go ahead and create an account. After you create an account, um, and you are trying to apply, but then there's different things that uh, you need help with. You can definitely click on the top and it'll tell you find help near you, and it'll prompt you to find a certified enrolled counselor or an agent. So let's say you want to find a certified enrolled counselor, it'll take you to this page right here. Put in your zip code and see what locations are near you for people to help you for free. So for example, I'm going to give you an example. Here we're going to go ahead and put Quint Tax Services, because you want us to help you. And you're going to find us right here on the top. After you click here, you're going to see that we have two certified enrollment counselors that can help you with your health insurance coverage. So you're going to click here and show certified counselors. Let's say you want me to help you. It'll tell you the languages I speak, if you need help in any other language, and it'll take you to this page. Unfortunately, since we're not signed in right now, it's not going to give us a full page, but if you're signed in and you click on find help, it'll give you a button right here on the top that will say continue. If you click that button, it'll take you to another page that will consent for me to access your information and apply for you. So once you do that, I can go ahead and get your information in there that you already clicked on, and basically is we're going to go back to the presentation. Basically, what we went over right now on certified enrollment counselors, I will have access to all of your information, and then we're gonna go over the plans and so on, and I could apply for you in case you don't want to go through the process. And this is completely free. I want to emphasize that all the help that you get from certified enrollment counselors are free. Please do not be misled by any other organization saying, "Yeah, this is free, but you could donate." No, we're not even allowed to take any tips or anything like that. So do not be misled by anyone that wants to charge you or anything like that. This is completely free help, okay? We already went through that, and I showed it to you live. So when you submit your application, we're going to send it. So after you choose your plan, we will submit your application. Do not send the payment. The carrier will send you an invoice to you. There is organizations that will ask you for a payment, like I already told you, for the plan, but that's just fraud. So do not do that. The provider that you selected, they will send you a an invoice to your home. We were already went over these plans a little bit, but just to touch over those a little bit more for you to see it in a broader way. We see here the bronze covers 60% of average annual cost. The silver covers 70%, the gold 80%, and your platinum covers 90% average annual cost. So after you see all those options that I showed you in the previous pages, uh, that's how you basically need to think about bronze, silver, gold. It'll cover the bronze will be cheaper in a premium, but it will cover less. The silver will be a little bit more expensive on the premium, and it will cover more, and progressively like that until you hit platinum. It will be expensive, or more a little bit more expensive than the other ones, and but it will cover 90% of your average annual cost. Uh, you have to think about the savings that you're also taking. Cover California is helping you so much. So taking this health insurance coverage outside of Cover California, it will cost you a fortune. So you want to go through Cover California to get your health insurance, and it's basically gonna be the same thing over here. Your co-payments are gonna be, for example, $20 on your platinum, but the premium is gonna be um, more expensive. Your silver, your copay will be 45, but the premium amount is gonna be lower. So you have to take in consideration what your financial situation is, and see what you can afford. And that's basically it. We wanna thank you for being here. Our number, like I said, is 562-291-2316, and we would be happy to help you for free to get started with Cover California. You can, like I said, the website for Cover California is Cover California, cover www.coverca.com, and you can check their Facebook page, Twitter, YouTube, and Google Plus, and they have different updates in there for you, and you can apply for just yourself in case you want to do it. So that'll finish the presentation. We want to thank you for coming in and seeing the presentation. We will be posting this presentation later in case you missed it or came in late on the presentation. We want to thank you and hope that you get covered right away. Thank you and have a good day.